If you get hip pain that feels like a pinching on the front of your hip, and this happens when you do squats or when you go from sitting to standing, you feel the pinch and you feel like you have to unkink that pinch, I'm gonna give you 2 stretches that you must implement into your routine in order to stop the pinch. And I'm gonna teach you 1 strengthening exercise to help prevent that pinch once and for all. So the stretching is gonna help reduce the pinching, and then the strengthening exercise is gonna help strengthen the glute to help prevent the pinch. Here's the deal. When you're getting a pinch on the front of the hip and it's in this area and it feels like something just is not releasing, or you feel it every time you squat, you wanna make sure that you do everything in your power to reduce that pinch. Oftentimes that pinch is caused by something called femoral acetabular impingement, where the femur of the hip socket, so here we have a pretend hip socket, and then we have the ball that sits in the socket, and it moves up and down, it goes side to side, and it also does some rotation in the socket. Well, if that ball doesn't move easily, it can cause a pinch on the labrum. The labrum is like a little golf tee that sits in the cup to help keep the ball in the socket. Well, if it's getting pinched, that can be really irritating. After pinching for many, many years, it can create inflammation, leading to degeneration in the joint, leading to maybe needing a labral repair or getting a hip replacement. We want to prevent that soliloquy of the events, so I want to help you reduce the pinch in your hip once and for all. The very first thing we're gonna do is when we go from sitting to standing and you get that pinch on the front of your hip, what I want you to do when you go from sitting to standing is I'm gonna have you place your hands right in your groin and you're pressing down on your hip sockets, helping the femur sit more in their sockets. And then you're gonna lean forward and then you're gonna squeeze your butt, pushing your feet into the floor when you stand up. And that's gonna help activate your butt, which is gonna take the pressure off the front of the hip socket, take the pressure off the labrum. Let's do it again together. So we're going from sitting to standing, and the move is to place your hands at the front of your hips, press down, press your feet into the ground, squeezing your butt as you come up into a standing position. That's gonna help take the pinch off the front of the hip. It is gonna be your new favorite tool to do to get from sitting to standing. Now we are going to go into a modified pigeon stretch, and when we're in this stretch, we're going to push on our hip socket again, helping the head of the femur go into the socket, giving us a better glute stretch, really allowing that femoral head to slide into the socket and create more of a stretch on our glutes, which is also freeing up the labrum itself, freeing up also the tendons of the hip flexor that can sometimes get pinched. So follow me, this is what it looks like. You're gonna be in a position like this. You can do this on the floor, you can do this on your bed, wherever is more comfortable for you. And then you're gonna go into this pigeon stretch, okay? Where you bring the leg back here. You're gonna take this hand, you're gonna press it down right in the crease of your hip, and you're just gonna hang out here, and you're gonna feel that stretch all along the back side of the glute. And you're just gonna hold it. Go for 60 seconds, go for 2 minutes, and really feel it. You might be able to sink deeper, and then you can go a little bit forward and really increase the stretch through the glute. Here's what it looks like from a side view. From a side view, you're here, you have your hand, and you're pushing down in the socket, rotating the femur out. So the angle of my force is that direction with my hand, and you're just holding it. You should not have a pinch in this position, and you should just feel a really nice buttock and glute stretch depending on where you carry more of your tension through your hips and your glutes and your hamstrings. And you will hold this for 60 seconds to 2 minutes, and this should feel like a very isolated stretch in the butt. There should be no pinching on the front of the hip, and you should do this every single day to help reduce the pinching on the front of the hip and reduce your acetabular impingement. If you're going into a workout and you notice that you get that pinching with squats, then just stop doing the squats, go into that stretch where you're pushing on the front of the hip, stretching out the buttock, and then go back into your squats and see if that helps improve your squat positioning. Because what that's doing is it's just teaching the head of the femur to slide in the socket where it's not typically used to sliding. Now we're going to do a strengthening exercise to turn on our glute medius muscle, also going to help us release the front of the hip, taking some of the load off the hip flexor tendons and load off of the hip labrum. So we're lying on our side here, and our goal is to activate the glute medius muscle, and that is located right here on the side of the hip. We don't want to be activating on the front of the hip. So it's really important that your brain connects to this part of your hip. And when you're here, you can bend the bottom knee if that feels better. You're going to raise up and come back down. Raise up and come back down, and you want to feel it right up in here. If you have a wall behind you, you can bring the foot up and down the wall, and that's going to really help isolate and engage the glute. You want to keep your tummy nice and firm and tight, keeping your back and spine stable and your pelvis neutral. You shouldn't be rolling open to do this exercise. You really want to stay stacked and keeping your hips facing forward as you go into this position, activating the glute medius. I would like you to repeat that 3 times 20 on each side, but say you stop feeling it in your glute and you're only feeling it down in your hamstring, or you're feeling it on the front of your leg or in your quad, you are not doing it correctly. So you only want to do however many that you can keep right inside your glute medius. I often like to keep my hand on that muscle, just reminding myself like, okay, that's the muscle I want to activate, telling my brain, activate this muscle, keep it active. The touch to the muscle helps that brain connect to that area and really focus there. So I do a lot of my exercises with my eyes closed so I can connect deeper to my muscles, contracting the correct muscles. I'm going to give you a bonus exercise. I want you to add in a bridge to help activate the glute maximus muscle. So the glute maximus is the big hip muscle that controls hip extension. The stronger we can get that muscle, the better you're going to have the pressure taken off the labrum. But it's hard to activate the glute max if you don't have this nice slide in the socket. So I highly suggest doing the initial exercise first, where we did the pigeon stretch with the mobilization of your hand pushing on the hip socket. Here we are just laying down with our feet flat. We are going to push the knees away from our body, squeezing our butt, pushing the knees away from the body, and then lowering slow. Push up, squeezing the butt, really feeling the butt. Try not to feel it as much in the hamstrings. We want the glutes driving this movement, pressing down. If you're not feeling your glutes, you can bend your knees a little bit more and press the pads of your toes into the ground and see if that helps you squeeze your butt. Come back down. If that's not a good cue for you, you can try flattening your arches of your feet. See, flatten your arches of your feet, really flattening them, squeezing your glutes, coming back down. And you should not be feeling this in your back. You're not arching up and you're not pushing down that way. Your spine is staying completely neutral. You're just squeezing your buttocks to get your really good glute maximus activated. And that will, again, take pressure off the front of the hip socket. If this is causing some pinching, then you might not be ready for this exercise. So do the other exercises first, then come back to this one. If you're like, I'm doing these exercises and it's not working, highly suggest working with a pelvic floor physical therapist who can help you release muscles in the glute, in the hip flexor, in the front of the hip, and also inside the pelvic floor. The pelvic floor muscles can cause a lot of the pinching that we feel on the front of our hips, especially if you've had children. Then those muscles can become very tight, creating impingement in the hip socket. So in order to help get that normal movement of the hip that we've been talking about, you have to release the muscles inside of the hip socket. And that's really hard to do with stretches. And so a lot of times it takes a pelvic floor physical therapist to be able to get into those muscles, reducing the tension, a lot of times reducing scar tissue and problems that have occurred inside the pelvis and inside the pelvic floor muscles to release. And then once those release, all of a sudden your hip will be completely released and you'll have freedom of movement. Then you can strengthen the right muscles and your hip will feel much, much better. I'm Dr. Allison Feldt, and I own a pelvic floor physical therapy clinic here in Edmonds, Washington, and in Poulsbo, Washington. And we have people fly from all over the world to come get treatment here. They'll spend 4 to 5 days with us doing what we call intensive treatments, and they'll do 2 to 3 hours, sometimes 4 hours of therapy, of hands-on work to help get their tissues moving and help getting their hip sockets moving normally. And then they go on and they strengthen on their own and they're good to go. But really to get your hip freed up so you can do the right movement on your own without hurting yourself further or without causing more femoral acetabular impingement and without causing labral tearing, labral fraying, labral pain, or more hip pain and hip pinching. You want to free up your pelvic floor, free up your glutes, and that will create so much more mobility in the hip socket. You'll be completely pain-free once you get that, and then you can start to strengthen, which is going to improve your longevity and of course improve your bone density. Women have such more likelihood of hip fractures than men. They also have a higher incidence of joint replacements than men. And a lot of that is due to the pelvic floor dysfunctions that women experience. And then they can't get the nice movement of their hip sockets, which then creates more bone thinning because they're not actually stressing the bone in the way they need to stress the bone. And so this is going to impact their longevity, of course. So in order to be the ultimate healthiest version of yourself, really everyone should have a pelvic floor physical therapy assessment just to find out where they are. And if you are having pinching in the hip and maybe you've been to your regular PT and it just didn't do the job, or you've been going to chiropractic, most likely there's something inside the pelvic floor that is causing that impingement that you should get taken care of today. So check out bodymotionpt.com and we would love to get you the help that you need. I'm Dr. Allison Feldt, like I said. If you could like and subscribe to this video, I would love that. Share it with a friend, and let's just get this out there so people can avoid hip surgeries, avoid cortisone injections. So much of the time, just getting this work done can save you years and years of pain and pinching in the hip. Thanks so much for joining me. I hope you found this helpful.